Okay, good evening, everyone. Welcome to today's webinar, Manage Knee Pain with Ayurveda. Thank you for taking time to be with us today. I'm Gaddafi from Nuffield Academy. So we at Nuffield Academy deliver high-quality continuing professional education courses and content for dental surgeons and dental support staff. Today, we are partnering with Nuffield Wellness to bring you this webinar. So before we begin our webinar, there are a few points that I would like to share. This webinar will be recorded. So if you'd like to share this recording with your family and friends, please visit the Nuffield Academy or the Nuffield Wellness channels on YouTube. And please feel free to post any questions at any time in the Q&A options in the below section of your screens. Our speaker will do her best to answer all your questions at the end of the webinar. So today's webinar, Management of Knee Pain with Ayurvedic Insights. So as you're aware, any pain is an unwelcome guest. But pain in the knee is something that which gets most attention because it blocks a person's freedom to move about. Knee pain can be due to several reasons and not always a solution has to terminate in surgery. So join our guest speaker, Dr. Varsha, to hear what pleasant solutions Ayurveda has to offer in this unpleasant situation. So a little bit background on Dr. Varsha, our guest speaker. She is a qualified Ayurvedic physician from India's Pune University and has practiced in Singapore for 8 years. She strives to bring authentic classical Ayurveda to the masses, friendly and empathetic. She has worked with many patients to relieve and treat ailments holistically. Without further ado, Dr. Veda. Sorry.
Thank you, Gad. Thank you. Good evening, everyone. Before we begin this session, let's invoke Lord Dhanvantari's grace, the Lord of Ayurveda. Om Shri Dhanvantaraye Namaha. May the words that flow out of this mouth be in accordance with Shastra and science. Welcome, everyone. We have this session going on for half an hour, and then we'll take question and answers in last 15 minutes. So without wasting the time, let me begin my presentation. Before we understand how to manage the knee pain, we definitely need to know what constitutes a knee. Any place where we can bend a part of a body, it's only because it's a joint where two or many bones can come meet together. They form a joint which makes us animal, whether it's a finger, whether it's a hand, it's a wrist, it's a neck, except of course for the skull bones or the last sacral bones. So it gives us, the joint gives us mobility to move, and there are certain components in the joint. Let's have the anatomy first seen so that you know what actually is in the knee. Let's have the anatomy. So the knee is formed by majorly three bones are there. The one that constitutes the thigh bone is called the femur. The lower where we call the shin, that is the tibia. And there is a one delicate bone also along with tibia. It's called the fibula, but that's not a part of the knee joint, though there are two bones in our lower leg. And there's a covering over these two bones where the tibia and the femur, where the thigh bone and the shin bone would meet. There's a small cap, we call it as a patella. So each of these two big bones, the long bones, the tibia and the femur, they are massively covered with so many layers. There are some cartilages, there are some muscles that it's only to protect this joint. And when we say muscles, we all know the front portion of the thigh, the quads, the back portion, the hands, we know all that. But what I have to bring a highlight over here is these muscles are joined. We can see on the next slide how the muscles, they join to form a very tough cord that is called as a tendon. And between the bone, so the muscle is linked to the bone with a tendon, and between the bone there are different cartilages, which in the next slide we'll be able to see properly what these bones are. Can we have the next slide? Okay, so this is just giving us the front view. We can see like the bone, the femur has that little different color. See, that's that cartilage that's at the end. So it's heavily loaded over there. It's only to prevent the friction so that we can move freely, not have pain, and to ward off any degeneration. So good cartilage, good fluid over there ensures that the joint is still young and ready to move. But it's not so easy. There are the joint is little complex. There are several ligaments that hold these three bones together, which we call it as knee joint. So depending upon from what portion they are seen, if it is coming from the front portion, so we all know it by the name ACL, we call it, right? So it comes from the front. One comes from the back side. There is something coming from the medial side, that is from the inside, and there's something from the lateral side. We'll see the side view, which is in the next slide, where we see the entire this picture, like how these bones are connected to each other, which facilitates the way we are moving. Whether we are sitting cross-legged, we are sitting on a chair, whether we are climbing the stairs, getting down the stairs, whatever movements we have to do. The sports people who have the reflexes, like if you see now the soccer is going on, the amount, the way the knee, the whole leg is used. The fast reflexes, let's say a badminton or a tennis, so we see how fast we have to move. So all this depends upon how young the joint is. That means how the cartilages are good. It's able to absorb all the friction, to move it very smoothly, to not have pain. So all this structure, if we come to know that what are the components in that, it's easier for us to identify if the problem comes, what would have gone wrong where. So the problem is going to come only in these components. There's nothing else out over there. And then again, there are some special, which we'll see in another slide, how there is some component called as meniscus over there, which is like a very nice cushion sitting between the bones. So it's like Lord's engineering. I always appreciate that this complex machine called man, God has made with such brilliant intelligence, like every part is taken care of so that the movements that it just gives us variety of movements, which probably we don't realize until we are not able to do that movement. We just take things for granted. We'll go for the next slide. So now what could be the cause? Immediately, we should be able to identify. When we know what goes in a knee joint, we should be able to just visualize what all can go wrong. There can be, let's say, external injury, there would be a fall or whatever. The movement or the body positioning was not correct. Some mechanical problem would come. That means in that structure, there should be some problem. There could be different types of inflammation of that joint, which we call it as arthritis. Or there could be some other problems. Let's say patella is having a problem. Or it could be a referred pain also sometimes, like the hip is having a problem or the ankle is having a problem. But to adjust that pain, you hold your body in a particular awkward way and you walk, which causes some awkward pain on the knee. So there could be other problems related, which would be causing a knee pain. So basically only these four things are there. So if we see these four things, like what could be injury? Yeah, like now, let's say some reflexes while playing a sport was so bad, the knee has twisted badly. Any of the ligament can snap off, or fallen very badly, the bone can crack off. There can be a fracture, or there can be the cushion which is there, that can create a problem. The meniscus can tear, or there's so much inflammation that the fluid accumulates in the knee. Or there could be some problem with the kneecap. So this is all related with the injury part. Mechanically, what can happen? Maybe some part had broken somewhere, and that is like floating like a loose body over there. There is something, a tension between the shin bone and the connecting to the femur, particularly a ligament or a tendon can create a problem, or the kneecap has just dislocated from that place and that's creating a problem, or some referred pain can happen. And then we saw arthritis could be a reason. Let's have that slide as well, please. So the bone inflammation can come due to various reasons. It can happen due to some natural degeneration where the cartilage is degenerating. We call such kind of a problem as a osteoarthritis. Or it could be sometimes the body's own immune system is creating a problem. We call it as rheumatoid arthritis. There could be some uric acid problem. So the uric crystals can go and deposit on the joint, which can cause a gout or a pseudo gout like a symptom can come. Septic arthritis can come. Arthritis due to other diseases, skin diseases like psoriasis and all, also can create some problem like psoriatic arthritis. So there could be various reasons. More than 100 actually. I've just listed the common two. Majorly, it's only osteorheumatoid that we see, but there are so many reasons why a joint could get inflamed by our own reason or by some external causes, or what are lifestyles that we are going to live. That we'll see in the Ayurvedic perspective. Let's go for the next slide. See, other problems like the patella also can have a problem. So we'll go for the next one. Well, what would be the risk factors? Who would be having a joint issue? So the predominant aspect is people who are overweight. So the knee is the weight-bearing joint, and it would crush and it would cause an easy wear and tear, and it could create a problem where the cartilage can get worn out easily. So we have to just see that this can be prevented by having our weight in check. So we need not go into a suffering. Some things we can prevent beforehand. Sometimes there's a lack of that muscle flexibility, or the strength is poor, and then you do humongous task. Or it could be something like very ambitiously you've joined for as a New Year resolution to some gymnasium, and probably don't have that flexibility, but you are overdoing certain things, and then a particular muscle, ligament, tendon can snap off. Certain occupations where you need to stand throughout or carry some weight, and construction workers, certain sports. So there are so many risk factors. That means they are people involved into these causes could be a reason why there would be a knee pain. Okay, let's see the next one. In this slide, there's a beautiful slide where we see the meniscus that is in the blue color. So it's like, it just fits like a half C shape between the joint, and it acts like that cushion. And sometimes there is a forceful movement where the knee could rotate. There's this trauma that can cause this tear, excuse me, which is not initially predicted. And it comes as a part of a reflex. You might think that you need to do or you can do, and then you get up in an awkward position. You carry a weight in awkward position. You kick or you play in a certain position. You will not know when, because it's a excuse me, it's a reflex action. So this is one part where we can see how a mechanical problem can come. Excuse me. Excuse me. I'll just zoom in this. We see over here like how a healthy joint would be. And some conditions where how the cartilage can wear out, the strength of the bone can reduce. It might not have the required density. That can create a problem. The bone can get eroded. So, sorry, these are just few aspects where we are just trying to highlight how a problem in a gross level can happen. We'll go for the next slide. See, over here also we can see like how the erosion of the cartilage is happening, and it's like a beginning to, a cause of friction. We'll go for the next slide. In this particular, see, one side we are seeing the healthy part. The other side, look at the amount of how the bone has eroded, the contents of the joint, how the inflammatory cells are occupying the place. So these changes in the joint is one of the things that rheumatoid arthritis is. We'll see the symptoms in the next slide. Where there is not just the pain, there is a swelling. You can see the healthy side of the joint, and you can see the other side where how the swelling is due to the inflammation. We'll go for the next one. So let's see what we see in rheumatoid arthritis. It's not just the pain aspect, but the knee gets very badly swollen. There can be temperature, local temperature, and even you can have like a fever also. The person feels extremely weak and unable to use the joint. There's a lot of instability. There's a lot of noise that comes along with it. Go for the next one. And the other condition, like somewhere there is like a locking kind of a pain that would happen in the knee joint, or inability to bend it, or inability to extend the knee joint can also happen. We'll go for the next. How we would identify whether it's a meniscal tear, whether it's a ligament tear. So there are different ways now. The modern science has advanced to where we can have lot of ways to scan from X-ray to different ways we can see the health of the joint we can assess. Let's go ahead. Now here comes the highlight and the point of tonight. What does Ayurveda has to offer us in this aspect? So Ayurveda will always believe in preventing. So we know why the knee pain can come, identifying its different components. So each component will have a certain role to play, and then the resultant is what we see is only as a pain. But whether the bone has a problem, or whether the ligament has a problem, whether the meniscus has a problem, there could be each component having different kinds of issue. But in Ayurveda, the perspective is now going to change. How can we prevent these injuries? How can we prevent for not getting the knee pain? We have seen the gross aspect. Injury we cannot prevent. Degeneration, yes, we can prevent. Not having good health, good immunity, can we prevent? Yes, we can prevent that. So for all this, we need Ayurveda. So where the scope of modern science finishes, there the Ayurveda begins, I always say. The component of Vata is not going to be seen under all those methods of scanning that they say. Okay, X-ray will not show Vata, CT scan will not show, MRI will not show Vata, nobody will say. And Ayurveda, that is a major component. Pitta is not seen, Kapha is not seen. Why I'm throwing these words, Vata, Pitta, Kapha? Because these are unseen aspects in the body. If they are in the balance, the health is maintained. If there is imbalance in that, then there are different reasons why a person can fall sick. In today's scope of this talk, we are seeing the knee pain aspect. How do these Vata, Pitta, Kapha exist in the body? They exist from the basic 5 elements. All the things in this universe are nothing but in the gross 5 element form, the basic element, very elemental state. And these 5 elements combine inside of the body as Vata, Pitta, Kapha. Outside, we all know the basic 5 elements. We see the space, we see the air, we see the fire, water, earth. We see so many different aspects. And these aspects only our sense organs can absorb. They go outside in the world and we gather the information, how the world is. From the eyes is a seat of fire. From the ear, the sound is the seat of space. The Akashavayu, the feeling, that touch, hot and cold, it's a Vayu space. The taste, it's the water space. And the smell, it is for Prithvi, the earth. So each of these are 5 sense organs. They are representing what is there out in the world. Apart from our 5 sense organs, we don't have anything else that we can go and grasp in the world. So with these 5 senses, what we can grasp, those are the basic elements. And these combine in various permutations and combinations. Like the space and the Vayu will permute and form a Vata dosha in the body. The fire and the water, that would combine to form Pitta in the body. And the water and the earth will combine to form Kapha in the body. Are these names important? No, they are not at all important. Do you have to know about it to understand? No, you don't have to know it. You can just feel it. You can, what your sense organs bring to you, and you can just feel that. So it is only a heightened awareness we can judge where we are standing. For example, if you're having cold, you don't go and eat some more watermelon or cucumber or cold water or any cold drink. You'll say, okay, give me some warm to have. So you don't need a rocket science. Your body tells you don't, but you just don't know that you are using an Ayurveda aspect for it. That's all it is. So I'm just giving a term and terminology, but that knowledge is not necessary to know your body symptom. Let's go to the next slide. I'm throwing some more names over here. Like I threw some names in modern, okay, there could be osteoarthritis, this is this, this is this, this is this. Ayurveda has also described so many things, very beautifully poetic, rich Sanskrit, and it keeps on singing the whole medical science in a poetic manner. So all things are there in the shloka form. Language is different instead of English, it's the Sanskrit. So Ayurveda has thrown some names for the pain in the knee. It can be called as Sandhigata Vata. That means the Vayu has gone into the joint. Vata Rakta. That means there is an issue not only with the Vayu, but it's also the issue with the blood, then the Pitta component. Then there is something very funny. It's called as Kroshruka Shirsha. Kroshruka is a face of a jackal. And how the jackal face is like that, the knee shape with it. That means it's only pertained with the knee joint, and Ayurveda has got this specific role of this Kroshtuka Shirsha, their description, like a jackal face. Then there is something called as Amavata, very typical USPs of Ayurveda. These are where you can't explain that under a MRI. Something like Ama is a so it's a vata, amavata. It's a problem of the wind only, air only. Air is not seen. That under no scanner we can see air. We can only feel from the work that it does and from the qualities. So from a karma and a guna aspect only we can identify that. So this particular concept, ama is in a simple term means that which is not digested. So let us say, imagine a fire lit by, let's say, firewood. You can't light directly a log. You start with a smaller branch, then the fire catches better, then you put a little bigger branch. So from a twig to a branch to a log, you gradually migrate to get a bigger fire. On a smaller fire, if you put a log, what happens? Fire definitely extinguishes and the log also remains over there. So this particular thing we will imagine in our tummy. Our digestive capacity probably is less, the digestive fire is less. And just because we like food, we have eaten. So if we have eaten when the digestive capacity is less, what will happen? Same that effect. The little fire will also extinguish and that food that we have consumed will remain in the body as undigested material. So this undigested material is what Ayurveda labels as ama. Then what happens? The absorption of the nutrients is not there. Excretion is also not going to be good. And it lies down over there, creating a problem. Having done once, is it a problem? No. When you repeatedly do that, then this ama traverses and lodges in the weaker part of your body. So if it is going and lodging in the joint, there it causes this ama vata. So one of the symptoms is you don't feel hungry, you feel heavy, you feel malaise, and you feel feverish. Yes, you can go ahead with the next slide. So now, what does Ayurveda approach? So when we know the problem is a vata, or a problem is a pitta, or this problem is a ama, it's easier for us to take decisions on that. And in Ayurveda, we have this fourfold of treatment, something to be given internally. Let's say it's just because of ama, then you give some medicines which would digest the ama. Problem would be the knee. Medicine is given to the stomach. See the connection. Problem is with the knee. Medicine is given for vata. Problem is with the knee. You say you don't eat this. And then, of course, the exercise. Exercise will form as a crucial part. In Ayurveda, of course, we say with the yoga aspect. But some exercise, we may not know the asana name, but we do a particular movement. And that is, again, very favorable to maintain a good joint health. Let's pick up now one each. So let's go to the next slide. So Ayurveda formulations, there are various formulations. Sometimes the first one which you see, they are fermented liquids that are placed. Some herbs are dried and just powdered. They are called churna. The first with the drums is they are called asava or arishtas. You must have heard draksha arishta, dasamula arishta, or Pippallasavam. So it depends upon how the formulation is done, but the main thing is they're going to be placed in the barrel and the natural fermentation by adding certain flowers which aid a fermentation. Then there are different oils. Its oils are not just external, but it's also given for internal use also. Then there are certain herbs that mix together and we make tablet out of. They are called gulikas or vatikas. Then there are some, we can say, paste format. Then there is something in the kashaya, the decoction format. These are called rasayanas, which are in the paste format. Decoctions are called as kashayas. So there are various ways the Ayurveda medicine is prepared, depending upon what is intended out of it, who has to take it. What is, like if you say kashayam, you need to have a good mental strength or preparedness to take a kashayam. These are little bitter liquids, but they work fantastic. Arishtam, they have, because they are undergone a fermentation process, they get absorbed in the bloodstream faster. So to give kids also, it's easy because it has a little sweetened taste. let's go ahead. Externally, what we can do. So externally, there are two ways. We just apply some oil, or we give some heat packs, and we stabilize the vata over there. Internally also, when we give medicine, it can be called as that first kind, the shamana, where you don't remove anything out of the body. You pacify the aggravated wind or the pitta or within the body. So that is called shamana, where locally you do something and you pacify the aggravated vata or pitta. And the shodhana aspect means you remove it out from the body. So sometimes probably the anal root is just a common in a vata kind of a treatment called as enema is used. Sometimes you will be using bloodletting, which we'll talk about it. And otherwise, the main treatment is externally when we talk is going to be the oiling and some heat. Many times, like let's say a rheumatoid arthritis case where there is a fever, or this kurushtuk shirsha where there is a nice redness and the swelling go together. So sometimes oil is contraindicated. So not in all knee joint pain we apply oil. So we have to assess that. If it's a pure vata case, definitely oil will help. But let's say there is something ama happening over there, and before we digest that undigested material, applying oil over there is going to be a problem. Let's go. So I've shown these various, we'll go back to the previous slide. I've shown these various kinds of boluses that are tied, right? So sometimes you put a dry powder into that bolus, depending upon what is the condition. If there is an ama or something, you just give a dry heat. Sometimes you need nourishment for the joint. So then we have got a special rice that's cooked in the milk, and that heat is given. And sometimes fresh herbs are also used. Let's go ahead. So what are the other ways? We just said about oiling and heat, but it can be just like simple oil application, abhyanga we call that. Sometimes we apply some paste. It's called a lepa. You just crush some herbs and you apply that paste on the knee. Sometimes along with the paste, we tie a bandage kind of over it and try to heat the local area. So that's called as a upanaha. Then these different types of kiris I've said, that whether we put a dry powder to tie that bolus to give the heat or the rice or the leaves. So there are different kinds depending upon what is that individual condition. You can't say, okay, osteoarthritis, this is the kiri. It doesn't work that way. We have to tailor make for that particular person. You have to assess his vata pitta. So it's very, very fine. You can't just assess over a X-ray or this. This is this case, so this is, we cannot. Individual, that proportion we'll have to come down very specific to see whether it's a vata, it's a dryness, or it's a pitta. There is already heat is over there. There is a lot of swelling, or there is a combination. So one size fits all will not work in Ayurveda. It has to get tailor-made, and that's why there are so many different kinds of ways that a person can be treated. Again, tailor-made for that particular person. So we'll not be classifying this disease is this medicine and this treatment. Then there is something called Ekanga Dhara or Sarvanga Dhara. Ekanga means you on one particular part. That means knee is paining, you're putting only on the knee. But let's say a Vaidya, the Ayurveda doctor has seen that the problem is in the knee, expressed in the knee. But the entire body's vata is going crazy. So you can put actually oil on the whole body. So it depends upon that person. We have to decide whether we just treat knee as local treatment or we have to do the full body treatment. Then Rakta Moksha is bloodletting out, which is my forte, using the leech therapy. And Patta Bandhana is different kinds of bandages are used. Again, a forte of Ayurveda. Let's go ahead. So this is an example of how the Upanaha is put on the knee. Let's go ahead. One of the leech therapies. And I've seen applying leeches instantly relieving the pain. Again, depending upon whether if it is a pure vata, then you don't need a leech. When the rakta component is involved into it, pitta component is involved, and you use the leech, we get a very good result applying leech for knee pain with redness, swelling. Go ahead. So there would be different solutions, different yoga poses, knee-specified treatments like we see over here in the picture called as Januvasti. Let's go ahead. Yeah, what to eat, what not to eat. Yogurt, everybody says a very good thing, but in a knee pain case, yogurt is a really banned substance. Better not have yogurt, and you should learn how to make buttermilk. You should know how to treat buttermilk with turmeric, asafoetida, ginger, curry leaves, and have buttermilk. It's better to do the amapachan. Amapachan, digestion of all those toxins. Undigested material is what you understand as toxins, and we call it as ama. So the big no for yogurt. Then all those nightshade vegetables, brinjal, tomato, peppers, potato, big no. All your favorite smoothies, ice creams, yogurt drink, milk and fruit together. Everything is called as Viruddhan in Ayurveda. So it's a big no in specifically a knee pain case. All your cold drinks, juices that are being actually bottled juices, all these, your favorite drinks, all everything is out from the picture. What you can include, which you have never liked, which you have never thought you can make the vegetable, those have to be included in the picture. We see some ridge god is there, snake god is there, bottle god is there, ash god is there. There are some millets, fruits like pomegranate, which we don't like to buy because there is a lot of work to de-seed them and eat. All that we don't like is very good over here. What we like is out in the avoid section, unfortunately. Let's go ahead. So another part comes is why we have to exercise, because it will help gain the strength of that muscle. It will make that joint stable and stronger. And when you get that strength, you are actually automatically avoiding the pain or any problem to come over there. It relieves the stiffness. Let's go ahead. So some isometric moves and wall slide you can see, like, you just lean against the wall and then stretch out that feet forward and then slowly slide without losing the touch from the wall to the sitting position. So you are not actually using the knee active muscle, but using all the pressure on the back. So when you do the movements, but you don't use the movement on the what involves on the knee, the muscles, then such moves are better. What I've not mentioned over here, I just remember suddenly when I said this, like how to climb the stairs and how to get down. It's like we try to keep the feet straight, just keep it outward and line the knee also in that outward direction. And instead of using the thigh muscle, because you are using the cord that is supporting the knee, tighten the glute and do it with the glute. So when you have to climb the stairs and when you have to get out, so that's one of the ways where you can damage less your knee. Let's go for the next slide. Some of the exercises, like you can do some calf stretching, quad stretch, ham stretch you can do, or this seated hip march. Just sit erect and then march so that it's a very good exercise to build the knee muscle strength. Let's go ahead. yes, we've come to the end. I've tried to finish as fast as possible. We started a little late, so I've taken 5 minutes extra to finish, maybe a little more than 5 minutes, so 7, 8 minutes extra to finish this, so that everything else I can take it into the question and answer session. So I'll take few questions if you have, and those who are in Singapore, yes, I'm available now for consultation. So do please contact. Ayurveda has got some lovely remedies, because not all problem is seen as a gross level. Okay, this is not fitting well, remove it, we'll put something else. Everything should not, oh, this is not having this, okay, you inject something. We need those extreme solutions are needed for the extreme cases, but to not go into that stage, we have got some brilliant solutions, doable things. And one before we go for the question and answers, a doable thing at home is, if you don't have the medicated oils, so much resources, you're not in Singapore unable to see me, because I see so many people from other country also. You use a simple sesame oil, that's enough. Sesame oil is easily available. Camphor is easily available. Just warm up the sesame oil, drop in one camphor into it, and oil your body regularly. You will not get into, if you have gone into the situation also, the same answer I would say. Always see that the digestion is perfect. You don't eat food because you like the food, so that the ama doesn't form and we don't land up in such a knee pain and ama is never diagnosed, and whatever you do is magnifying the pain. Okay, so I'll just see if any questions. It's open for question and answers. If you have, please type in. Sorry. Any hands to be raised for any question and answers, please? Or you can type a question. And we'll be very happy if no question means you've understood it very clearly. My sir used to say otherwise, if you've not understood also, you will not have any questions. Oh, thank you, Gabriella. Yes, it would be amazing. Eventually, I think Nuffield should be venturing into traveling to Europe to give talks, see few patients. If that happens, works. Yes, we should be able to do that, Gabriella. Thank you for that suggestion. Any more questions? Excellent. So at least since there are no questions coming in, I'll say a few quick things. That one was this: use at least sesame oil. Just see if your knee feels extensively hot. If you feel that the knee is extensively hot, don't put oil. Then you do a home remedy. What you can do is the crystal salt, not the salt powder. The salt which you get in the stone form, the crystal salt. Just take a fistful of that salt, cut lemon into 4 parts, and you tie that together. Warm it up on whatever you have, some pan, and apply that heat. This could be another home remedy. When not to use oil. So when you have fever, when there is swelling with redness and warmth, you don't have to use oil. When you don't have an appetite, you feel aversion for the food, you don't have to use oil. So first we have to digest the ama, but the pain is there when we will digest the ama and then. So in such conditions, the dry heat has to be given and not the oil heat has to be given. And those who, I see some people from India also who have joined. In India, some herbs grow at the roadside itself, like a castor plant. You will be finding growing at near some garbage area somewhere. You'll find some castor plant on the roadside. You might be standing under the shade of a tamarind tree. So some of these plants, like the tamarind leaves, the leaf of the castor, these are excellent in just absorbing all the pain. So in that thing, like how I said, you tie the lemon and the salt. You throw these leaves into it and you tie and then give the heat. Or the castor plant leaf is like so wide. You can tie a castor plant leaf also by heating it on the leaf. So uh, the techniques are very simple, very inexpensive. But unfortunately, few people know it, and expensive treatments are going on. So many times I feel very sad that this could have been in an inexpensive manner treated. That's why this topic, it looks very vast and very dangerous, but actually the solutions are very simple when we come with Ayurveda. Okay, so I don't see any more questions coming. I think we can end the session then with prayers to the Almighty for everyone's peace. I chant a small prayer and I'll translate that as I chant. Om Sarve Bhavantu Sukhinah. May all be in peace. Sarve Bhavantu Niramayaha. May all be disease free. Sarve Bhadrani Pashyantu. May all see only auspiciousness everywhere. Ma Kaschit Dukkha Bhag Bhavet. Let nobody be unhappy or in pain. Om Shanti Shanti Shanti. Let there be peace in the external world, in the immediate people around me, and within me. Thank you everyone for joining me tonight. Next week also probably we will have another session. I'm planning to have at least till the new year, one per week. Maybe we have 3 more sessions probably. Let's see. And those who have my number or I had actually posted now, you can get in touch with that. And if you have any topics to suggest, you want to hear from me something, please do let me know. I'll pick up the topic what you would like to hear. Some of them have asked me for menopause and all also. So I'll be adding those topics, and those who want to regularly hear, keep a big list for me. I'll prepare all those topics and we can probably have every week or every fortnight in whichever way is convenient. Thank you. Thank you for joining.
Thank you very much, Dr. Varsha. Thank you very much, everyone. Have a good night.